Good evening. I am 𝗧&𝗧'𝘀, and it is my pleasure to welcome you to another episode of One-on-One, where we bring to you some of the best minds in Trinidad and Tobago. Tonight, we will be certainly living up to our mantra of bringing you some of the best minds in Trinidad and Tobago, as we have none other than the brilliant Dr. 𝗬𝗪𝗪𝗀 with us tonight. Dr. 𝗬𝗪𝗪 is a very well-known public figure in Trinidad and Tobago and really needs no introduction. However, I will still say that Dr. 𝗬𝗪𝗪𝗀 is a former Minister of Education of Trinidad and Tobago, possibly the most famous Minister of Education of Trinidad and Tobago because of his accomplishments. He is also the former Caroni East MP. He is an obstetrician gynecologic oncologist and surgeon by profession. He is the former senior lecturer and dean of the Faculty of Medicine in UWI St. Augustine. And he is also well known as being a former Trinidad and Tobago and West Indies cricketer. So we have with us tonight a very esteemed panelists, and we're deeply, deeply honored to have Dr. 𝗬𝗪𝗪𝗀 with us. We've been asked on many occasions, when you get in Dr. 𝗬𝗪𝗪𝗀, when you get in Dr. 𝗬𝗪𝗪𝗀. So I think we were very lucky. For some reason, the stars aligned, and here is Dr. 𝗬𝗪𝗪𝗀 with us tonight. So our topic tonight is the state of TNT's health sector. And we can quote Prime Minister Dr. Keith Rowley as saying that we in Trinidad and Tobago have the best public healthcare system in the Commonwealth. But really, is our healthcare system up to standard? Now, we've had several episodes on healthcare since we started this podcast, and the complaints seem to remain the same. Long wait times for appointments and procedures, not enough beds, a shortage of medical supplies and medical personnel, outdated equipment, remuneration and other workplace issues faced by our doctors and nurses, and the list goes on. And we've been talking about these things for a period of 2 years, and yet we are not seeing any kind of improvement. So this is what we are here to discuss. With an average of 6 billion annual allocation to the Ministry of Health, are we the citizens getting value for money from the public healthcare system? This is our leading question, and it's the question that we will open our panel discussion with tonight. So I would like to welcome you, our viewers who have joined us. I am seeing the regular people coming on the Zoom already, and also those who will join us on social media, and also members of the media who will be joining us. We will be leaving some time at the end of the panel discussion for Q&A and open mic, as we normally do. I know there are many people that are going to want to talk to Dr. 𝗬𝗪𝗪𝗀 because my phone has been going off since that ad went out, right? So we are going to leave sufficient time for you to engage with Dr. 𝗬𝗪𝗪𝗀 tonight. And please feel free to leave comments and questions on the chat. We usually have a very active chat, especially on social media. Your feedback, of course, is very welcome. So without further ado, I would like to welcome you, Dr. 𝗬𝗪𝗪𝗀, to our platform for the first time. And I know it's not going to be the last because everybody comes back. And I would like to kick off our discussion with the opening question. The Ministry of Health has a budgetary allocation of roughly 6 billion TT per year. Would you say that the citizens of Trinidad and Tobago are getting value for money from the public health sector?
First of all, Ms. Doré, it's a privilege, a pleasure, and an honor to be with you on this program and your colleagues, and to, let me say, a very warm good evening to your viewers and your listeners on this very important program which you have been conducting for a number of months and possibly more than a year or two. And so for me, it's indeed a privilege to speak with you and your listeners on the important topic of healthcare. And you mentioned over the last 9 years, eight years since Dr. Rowley's government has come into office in 2015, with a lot of promises, many of which remain unfulfilled. And they have spent probably close to between $50 to $56 billion over the period of the 8.5 years since they have been in government. Now, the issue is whether the citizens are getting their health care, which is a democratic and fundamental right of every citizen to have an adequate health care and the provision of adequate health care. Let me just go through a little bit of the infrastructure in terms of the healthcare system. We have 10 hospitals in Trinidad, public hospitals, and we have 105 health centers and 9 district health facilities, which are supposed to be open 24 hours round the clock. We are not sure now whether these 9 hospitals, 9 district health facilities are open 24 hours, but they were constructed to be the intermediary type of health institution to take the burden of the load of the general hospitals. We have the General Hospital in 𝗏𝗏, which is now a shadow of what it was many years ago. We have the St. Anne's Mental Health Institution, 𝗬𝗓𝒻A Hospital, the Eric Williams Medical Sciences Complex, the San Fernando General Hospital, the Point Forte Hospital, and well, we have the one in Scarborough, Tobago. And we have a number of district health facilities like the St. James Health Facility, which was a district health facility. Now, Trinidad now is divided into 5 regional health authorities, 4 in Trinidad and 1 in Tobago. And this began in 1997 under the PNM administration at that time of Prime Minister Manning. And John Eckstein was the Minister of Health when they formed the 5 regional health authorities. They tried to copy the British system of the management of health and health institutions and healthcare. Now, the British system has moved about 10 paces away from that already between 1997 and 2023, 2024. And we are still caught up in the administration of healthcare with the outdated RHAs, which are 5 in number. And I will speak a little more about that in a while. And serving the population in various parts of Trinidad. The RHA is supposed to have independent healthcare management operations at the top, with a hospital medical chief of staff, as a chief medical officer for the institution, and different intermediaries in terms of administrative capacity and capability. And doctors at various levels, from interns to house officers to junior registrars to consultants to subspecialist consultants. And then you have nurses at different levels, the top matron of the hospital, the head of the nursing, and various senior nurses, midwives, etc. And then paraprofessionals in various areas of the hospital healthcare management, like radiotherapy, physiotherapy, laboratory, X-ray department, and so on. One hospital will have about 31 centers of work. And they go through from accident and emergency to operating theaters, to the wards, to the attendants, to various levels and categories of provision of healthcare. Now, so it needs tremendous management capacity and capability. And this country has been very devoid of having the type of capacity and capability for the management of healthcare. And you have to be very well trained. Most institutions internationally have healthcare managers who have been fully trained in healthcare management. So we don't have a system like we have at the 𝗏𝗏 Eric Williams Medical Sciences Complex, where we have a carnival band type of consultant who puts up stages and props and so on at carnival events. As the CEO of a major health institution, because of political association, when that institution is supposed to be one of the mecca of the provision of proper and adequate health care. It's nothing on the character of the individual, but when you have someone who does not have the knowledge and the expertise and the capacity and the capability to run an institution, to manage an institution like that, it is very sad. And that is one of the first things that we will have to ensure when we come into government again, that the people at the helm are people who are qualified to be there, who are capable, competent, and can manage. Healthcare management is a formidable type of management. You have to know where you are. You have to know what you're doing. And I would say, with the exception of Dr. Khan, who himself was a doctor, and to a lesser extent, Dr. Rafiq, who was a general practitioner, this country has suffered from the lack of capacity and capability as health ministers are concerned. We have not had a proper health minister in this country since 1997, except the two that I mentioned a while ago. And it goes back to John Eckstein between 1997 to 2000. And then when Dr. Rafiq and they took over, Dr. Rafiq and Ford Khan, there was some competence at that level, a great deal of competence. But then you had in 2000 to 2002, Minister Colm Imbert as Minister of Health. Then you had Minister John Rahel, who was undoubtedly, not a person fit for it, to be running a health sector. And after Mr. Rahel, you had Jerry Nares, who they all would have tried, but it was beyond their scope and their capability and their capacity to manage a health sector. And then, of course, Dr. Khan came back in and did a tremendous amount of work again. But then everything has been reversed once more. Once you get out of government between 2010 to 2015, everything fell apart again within this last 8 or 9 years. So in terms of the ability to spend that money properly, the $56 billion, healthcare is like a bucket. You keep putting money into it all the time and it will keep falling out like a boat. You spend a lot of money on the boat. But with proper management, you can effectively get what you require. And unfortunately, as you mentioned at the beginning, that there have been general and widespread knowledge that patients enter hospitals and healthcare facilities with the hope of being cured and taken care of in these institutions. And many come out as corpses at the end because of negligence and mismanagement and incapacity and unable to provide a proper health care for patients within the institutions. And a simple thing as management, where you have patients lining up in an emergency department and on trolleys and on wheelchairs, dying on trolleys, falling off the trolleys, sitting on the wheelchairs, and almost 50 people in the emergency department waiting to receive proper health care, waiting to be seen by doctors for 24 hours, and being transferred to the ward when there is necessity for transfer onto the wards. Patients die in emergency department without getting the necessary type of medical management. And that is because of improper management. when you could be emptying the wards, and if you do the right things for the patients on the wards, you do the surgery that they require, you provide the proper medical management for them, and you work with the patients and you teach the patients what need to be done and the families, you can be discharging the patients as fast as possible, rather than a backlog of patients on the wards, and you cannot move them from emergency department. And you need to streamline your emergency departments into different areas. And so it calls for management at a level of the people who are running it. And if they are not capable, well, this is what you receive. Eric Williams Medical Sciences Complex, known as Mount Hope Hospital. This is an area, the emergency department is one of the worst. Then you have San Fernando Hospital, where they are trying, but they're unable to meet the requirements of moving the patients along. And many things within the hospital system prevent them from effective management. First, you may not have the attendants in the hospital because the attendants, sometimes they take their leave, and so it needs management of the human resource system. You may not have adequate doctors, where there are 400 young doctors now waiting for jobs as young house officers to be brought in as house officers. They're waiting for jobs, 400 of them at least. And in 2021, I think a question was asked in Parliament, what is the composition of the human resource personnel in the RHAs? The answer was 17,700, and 37% of these positions are vacant, including at least 1,700 nurses and hundreds of doctors and other paraprofessionals. Nearly 6,000 vacancies exist in the RHAs of 17,700. That was a question that was answered in Parliament when asked in 2021. Now it's possibly even worse.
But Doc, could I interject here? And I know you have other points, but because you brought that up, you actually came to the question I was going to ask you, which is basically, you just gave a very damning statistic that we have 36% of vacancies available in the RHAs, meaning we have a shortage of doctors and nurses and EHS personnel, that kind of thing. Yet still we have doctors waiting to be assigned to jobs and so on. What is the dichotomy there? How come we have doctors waiting to get jobs, yet still we have a shortage in the public sector? Does it boil back down to poor management, as you are saying?
Well, it's a lack of care and attention. If you have a minister that is supposed to be appointing, and cabinet appoints the boards of the RHAs, so it's supposed to have 4 regional health authority boards, which create the whole movement forward of what is required within the administration of healthcare. And you have people on the boards who will have never visited the hospitals. You have boards that do not even make rounds, have a look at the institutions in which they govern. You have CEOs who would probably never make a rounds in the entire institution, but probably will do it once in a month. And the human resource management in these RHAs now are all politically governed. People will get jobs based on their political allegiance, which ought not to be taking place. The health of a citizen is a fundamental right, and a deprivation of anybody's health and leading to death is criminal in intent. So you have 4 RHAs in Trinidad and 1 RHA, and misfits up there. They do not even have an understanding of what their jobs and purposes are. Well, you have no leadership at the Minister of Health. The Minister of Health has no leadership. He himself has been a pharmacist. And I don't want to go further into that. There's not any character assassination and so on. But the question is, has he been really putting, how many of these institutions has he visited except to go at Christmas time and give out babies hampers and so on? You have to make an in-depth detailed rounds within there's only 10 hospitals to move through, and the health centers and district health facilities. A proper minister will be on the ground asking questions, bringing the boards, the regional health authority boards to answer to what it is they're about, getting the CEOs and the human resource officers to answer, why do we have these amount of vacancies? Are we not supposed to have these vacancies? Because under Mrs. 𝗏𝗏𝗧 government, there was a training school in Tacarigua which trained hundreds of nurses and midwives and at different levels of nursing care. And then we had the medical school at Mount Hope, and the medical school was putting out over 150 graduates per year from Trinidad. And now I think the government has cut that back significantly to allow probably less than 50 or 60 doctors from Trinidad and Tobago for training. And those who have qualified, they have not employed them, over 400 young interns. And when you have about 20 different departments in a hospital, orthopedics, neurosurgery, general surgery, obstetrics and gynecology, pediatrics, different areas where you need teams of doctors, 2 doctors or 5 doctors in a team like that would be not much to add. But if you have 20 different areas in one regional health authority and you add these 5 doctors in one area, that's 100 taken care of. In 4 RHAs will be 400 taken care of. So the doctors will be gainfully employed, but also in training, doctors train, they go through the system of training. They start as interns for a year, then house officers where they work under consultants. They train for about 2-3 years. They become junior registrars, and then they join a system for postgraduate training where they become specialists and then consultants eventually. But that system in Trinidad does not exist now because the junior doctors are not there to be able to go through the system. Soon, we will be short of the consultants and the senior doctors at the highest level who are capable of doing the type of surgical procedures and with the experience and management. And healthcare will continue to fall and deteriorate over a period of time. So it's the most important thing here, I would say, is ineffective, inadequate, incompetent healthcare management with the wrong people in the positions and unable to deal with the knowledge that they're supposed to put out there for the healthcare. And that is one of the fundamental things. Beside the other issues of the C40 administration of drugs has been chaotic all the time. It has not improved. You have one major health supplier of all the pharmaceuticals. I think the budget for pharmaceuticals is close to about 400 to 500 million almost every year. One major pharmaceutical company probably gets most of the drugs into the healthcare system, about 350 million. You have drugs that are not functioning properly. For instance, the chronic non-communicable diseases of diabetes and hypertension, which we have begged the Honorable Minister to provide better medicines for these rather than the cheap 1-cent pharmaceuticals, which the patients are getting under the CDAP program for the treatment of diabetes and hypertension. He promised to do that many years ago and has been unable to change the medicine for the treatment and management of diabetes and hypertension, out of which all the other disease processes basically stem from these chronic non-communicable diseases.
Dr. 𝗏𝗏𝗧,
diabetes, yes, Mr. Ray.
No, by all means, go ahead.
Diabetes, hypertension, cancers, and to some extent lung diseases. They are chronic non-communicable diseases. And they ought to be taken in the light of the preventive measures. First of all, preventing somebody from getting diabetes is by proper education programs in the country, and there is none. Why can't we utilize the radio and the government stations and the TV stations to have ads educating the population of the necessity for things like diet and exercise and proper eating habits, and looking at the family problems and the testing of diabetes at an early stage, and also hypertension. It is well known that about 40% of the East Indian population above 40 years of age are diabetic. And the same above 40, about 40% of the Afro-Trinidadian population are hypertensive. So we have young, strong-looking guys moving around and have never really tested their blood pressure until they find out that they have renal failure because they had hypertension and never checked for hypertension. Then you have the cancers. We have about 12,000 deaths annually in Trinidad and Tobago now, about 6,000 men, 6,000 women. The birth rate is falling. At one time it was 26,000, then 19,000, 18,000, 16,000. The last set of figures coming out from the Ministry of Health itself is like about 12 or 13,000 per year now, new births per year. So that has fallen. But deaths have increased. And if I'm not mistaken, I think one of the last 2 years, the deaths were close to about 15,000. So here it is, a Minister of Health supposed to be educating the population of what the issues are, how many deaths are occurring, what is the birth rate, how many deaths are occurring as a result of diabetes and hypertension and cancers. We have to search for it from the Central Statistical Office. I have to bombard the CSO to find out the true facts, and they only have it up to about less than 4 years ago. They don't have it, I think, beyond 2018 or 2019, and they're not certain what is the true thing. And this is where planning comes in. If you don't know your death rate and what patients are dying from, how are you going to plan? Well, if they're dying from diabetes and hypertension and strokes and cardiac events and so on, about 2,000 die annually from heart attacks and cardiovascular events. 1,000 die from diabetic complications, and about probably 1,200 die from cancers. About 600 men, 600 women. The commonest cancer cause of death in women is gynecologic cancers, which account for about 45%. That's the cervix, uterus, ovaries, and so on. And then colon cancer. Sorry, breast is the number one, with over 220 deaths per year. And then those are the gynecologic cancers, and then colon cancer in women. And in men, prostate cancer, of course, then colon cancer. So where are the screening programs for these? And first of all, now cervical cancer is a preventable cancer around the world because of the vaccine that is available worldwide for children under 12 years of age, girls and boys, to be vaccinated with the vaccine to prevent the human papilloma virus from spreading. And from the girls, when they become sexually active, to prevent them. In fact, one of the countries in the world, Australia, has now benefited significantly with the cervical cancer issue. There are very, very few cases now of cervical cancer coming on because the Australian population sought, the Australian authorities sought to vaccinate the boys and girls in the school up to age 14, 15. And even though you may have been sexually active, but the best time to vaccinate the children when they are not sexually active, like under 12 years of age, one vaccine shot. Then where's the screening, the pap smear screening program to prevent breast cancer? No person is supposed to really develop cervical cancer, because if you're screened and regularly, and any child, any young girl who is sexually active must be screened with pap smears at least 2 to 3 years after becoming sexually active, and have the screening every 2 to 3 years. And once you have about 4 or 5 are negative, you can relax a little bit. Then breast cancer. Every woman above age 40 should have an annual mammogram done above age 40, an annual. So if it is picked up early, a mammogram will pick up a cancer which is less than 1 or 2 millimeters, whereas a patient or a doctor might pick up a breast lump when it is 1 centimeter or 2 centimeters in diameter, which is 10 times the size that the mammogram will pick up. So where are the screening centers in Trinidad and Tobago? None, except somebody has to pay for it. So breast, you should have screening mammograms across in all the district health facilities and at least 1 or 2 of the health centers and the hospitals. For men, you hear the Prime Minister talking about the prostate cancer and so on. And it was good of him to really bring this out, but the population has not bought into it. It is a very simple blood test that the healthcare system should be able to have centers where men can go in and have the PSA done, the prostate. And then the population should be advised as well to have those particularly above 35, 40 to have colonoscopy and gastroscopies every 5 years. And if you have an incidence, colonoscopy, colon cancer runs in families. They call it familial polyposis coli, which means that families who are having these type of polyps develop cancer over a period of time. So the screening for cancers are not available. The testing for diabetes and hypertension not widely available. And under Mrs. Kamla Prasad, besides the government and under Ford Khan and so on, we had over 100 health centers, probably a little less than that, began to open up to 9 p.m. and on weekends and public holidays, staffed by a competent doctor, a nurse. One pharmacist may be responsible for about 3 or 4 pharmacies. And so patients, citizens leaving their workplace can go to a health center to have themselves checked. But particularly the underprivileged citizens who need to have their things checked can go after work. And this was working in favor. As soon as Dr. Rowley's government came in, the Minister of Health began to close these centers, which were open up to 9 o'clock, and some on the weekends and public holidays. And that began the decline in the control and management of diabetes and hypertension. And Ms. Doré and Ms. Safraz and listeners, the hospitals fill up with the complications of these 3 chronic non-communicable diseases. Diabetes, blindness is one of the major issues. Then you have gangrene on the legs, ending up with amputations. And we have Professor Narayan Singh would have mentioned that over 500 amputations per year in Trinidad and Tobago. That ought not to happen if the diabetes are taken care of. Well, heart disease, strokes, all these are complications of diabetes, sudden heart attacks and dropping dead. That also is a complication from hypertension as well. And so the entire complications, the gamut of complications from these 2 diseases of diabetes and hypertension are what fill up the wards in the hospitals. So instead of having to manage the complications, we should be preventing the complications. And this is where an astute leader, an astute Minister of Health, picking the appropriate team of regional health authorities personnel who know what is supposed to be done. And when you have a CEO walking the wards and walking the hospitals, making sure that patients are properly managed and taken care of. Let me just give you a little story. When Minister Khan went abroad, sometime when we were in government, I would sometimes act for him. And once, different people will act at different times, it's for a short period of time. And once I went to Mount Hope Hospital, and I said, let me go and see what is going on there really. But this is not a boast, but I was the first medical doctor, to do the first gynecologic operation at the Mount Hope Women's Hospital in 1981. We helped to open Mount Hope Hospital, that is 43 years ago. So when the Eric Williams Medical Sciences Complex was being built by 𝗬𝗎, I was already a consultant at the Women's Hospital from 81 to 85 and so on, why 𝗬𝗎. So I know Mount Hope in and out. And when we opened the medical school in 1987, our UWI medical school in Trinidad, it was about 5 professors, Professor Bartholomew, Rolf Richards, Butler, David Piku, Professor Melville, who was one of the, God bless his soul, most of them have passed, but Professor Bartholomew. I was one of the younger ones that had just come back specializing and so on in obs and gynae. And they asked me to give some help in terms of finding, getting the hospital open. When NAR came into government and they said, we cannot open the medical complex at Mount Hope, the medical school, you have to be self-sufficient. So we decided we'll take students from Manipal University, and they paid $12,000 US per student. And that's how we opened the medical school in 1987, which is now 37 years strong, going strong and having some of the best doctors that graduate. So we are producing good people, but we don't have the system to facilitate them working in adequate conditions. You don't have the pharmaceuticals, you don't have the supplies for orthopedic surgery, for neurosurgery. You don't have the laboratory reagents for doing lab tests. Patients have to go outside. They have to take their blood. The families have to go outside, get the lab tests done, and come back with it, which may take about 2 days. And by that time, the patient is dead. You don't have the basic drugs in the hospital wards, the proper antibiotics. You do not have the proper chemotherapy drugs. And I've always had to speak about that publicly, because cancer, oncology, if you're treating a patient with chemotherapy, you have to have the first line, best type of drugs. You can't give them the best drug now, and in the second dose, give them the one that is not efficient and effective as the first. So you have to provide as best as possible. And I want to recommend, I mean, this is open, my political leader must have heard me speak about this at some time, but someone who worked across the world, I worked in about 18 hospitals around the world. I worked in 5 hospitals in Canada, 4 in England. I worked trained in Mount Sinai in New York for a while. I worked in Bogota in Colombia for a number of months. Of course, as medical students in Jamaica and Barbados, and I worked at Port of Spain Hospital and so on. The issue is when you work in these institutions, you see the best type of medical care that is given. And you're supposed to continue that and practice that within your system. So we have very well-trained doctors, nurses. Nurses go abroad now and they make about 90 to 100,000 US per year. That's 600 to 700,000 TT. And you find them in the hospitals in Miami and so on, and Toronto and Canada, and even in England. So we have to give incentives. And when doctors are not employed, and those who are employed, not even give them a contract, they get 1 month to work here now, and you could be fired. You get 3-month contract, you get 6-month contract or 1-year contract. Nobody gets a 3-year contract to say that they can go to the bank and get something. The nurses are treated badly. The nurses are overworked. They're understaffed. The doctors are overworked, understaffed. So it's a mess outside there. And calling for proper management and skills and competencies. And you can utilize the same amount of money, Ms. Dory, Ms. Sally, and listeners, but you have to have the ability to use it wisely. And it is very sad. So we have promises made by this PNM administration from 20 10 when they had a manifesto in 2010 when we defeated them. But they came back in 2015 speaking. In fact, I wrote down some of these promises. In 2016, they promised a universal health insurance. They repeated that in 2017, 2018, 2019. So keep rehashing that they will have a universal health insurance. In other words, the business employers will pay a certain amount, the employees will pay a certain amount, and for the indigent population, the state will pay for them, so that there is a level of equity in the provision of healthcare. They promised in 2015 that they will get an operative for the Eric Williams for Mount Hope Hospital. Up to now, 9 years later, no operative to help them. Nobody wants to work with them, with this government. They promised an offshore medical facility. They waited for a Welsh report to come. Dr. Welsh is one of my colleagues. We worked together for a number of years. We graduated around the same time in medical school. And they were waiting on a report from his team for 2 years. They took 2 years to bring a report. And the report had no additional recommendations other than the 𝗧&𝗧'𝗀 Commission of Inquiry recommendations, which was done in 2007 to 2008 under Manning administration, when the healthcare system was pathetic and the people were calling for improvement in healthcare. 𝗧&𝗧'𝗀 Commission of Inquiry revealed a number of recommendations. And the Welsh report, also co-authored with the professor at Harvard University, who has been given the Order of the Republic of Trinidad and Tobago. I understand he's quite a brilliant doctor. But the report showed nothing, and Dr. Rowley keeps saying all the time that we did not support him in taking that report to the Joint Select Committee of Parliament. We did not recommend that to the Honorable Leader of the Opposition because there was nothing new in it that needed to be discussed at the Joint Select Committee. And so he keeps saying that we stopped that, and this is one of the reasons why the healthcare system is as bad. It is because of their incompetence or the inability to govern the health sector. So they said that they were going to have an offshore medical school. Yeah, 2017, the report came out. 7 years later, where's the offshore medical school? They said that they make 𝗚𝗶 Hospital a full teaching hospital. 𝗚𝗶 Hospital is closed for nearly 9 years now. A hospital that costs $2 billion and can provide proper and adequate health care. They had to take COVID to help open the 𝗚𝗶 Hospital when COVID came around. So in 2022, they said they will make 𝗚𝗶 Hospital a center for treatment and management of renal disease. There's no renal disease program there. They spoke about medical tourism. A special purpose company was formed with UWI for 51% UWI own the 𝗚𝗶 Hospital now. And what have they done with it? Absolutely nothing. For years now, the UWI has been a 51% partner because, as Dr. Rowley said, they owed UWI over $1 billion. So they give UWI 51% shares in the 𝗚𝗶 Hospital, but UWI has done nothing with it since. In 2019 and 2020, they promised a cardiac cath lab at San Fernando Hospital, which is a life-saving type of laboratory where you do angioplasties and angiograms for heart, blood vessels, and so on. And you can stent someone at the same time you're doing an angiogram and prevent the persons from getting heart attacks. And the doctors down there have been calling for that for the longest while, and they haven't been able to do it. Dr. Rowley promised, when he came into government, a new central block at 𝗏𝗏 Hospital. It's now 15 to now, 8 years. No central block at 𝗏𝗏 Hospital. It's now 2024, only about 40% completed. And that's a shame. It's an abominable shame. So it's promises upon promises by this government remain unfulfilled because they don't have the competence. I think they don't have the manpower. They don't have the capability to do what they're supposed to do. Look, let me just So it's rehashed promises and no tangible measures to improve the quality of healthcare. And then what we have then, long waiting time for critical surgeries, things like cataracts operations, which could be done in 10 minutes by an ophthalmologist. There's a simple machine called a phacoemulsifier that extracts the lens, the cataract lens. They don't have that functioning for years, which makes the operation very easy. They have outdated drugs, critical shortage of CDF drugs and medical supplies. No lab reagents, chemotherapy drugs, long waiting times for CT scans and MRI. At one time, there was one CT scanning machine for the entire country, when each hospital supposed to have a CT scanning machine. And I spoke about the medical staff shortage. So when you look at what under Mrs. Kamla Prasad-Bises's government did, in terms of construction, we completed the Arima District Health Facility. It was constructed. That's not the hospital. That was a district health facility. We built the 𝗚𝗶𝗶 Hospital in 2 years. We commenced the Arima and Point Fortin hospitals. And since 1990-something, the PNM government had been promising to construct the Point Fortin Hospital. It took a UNC government in 2015 to begin construction of the Point Fortin Hospital. And these 2 hospitals now constructed, but it is nothing different from being like a health center, because there's no purposeful and meaningful type of medical care that is given to the citizens in these areas because of improper management and lack of direction and lack of a vision of what they're supposed to be doing there. We were continuing with the construction of a national oncology center, which means an oncology center, oncology cancer, where you bring all systems together under one main roof. For instance, a CT machine, an MRI, to plan what is happening with the patient. Chemotherapy drugs to be given there, surgical procedures to be done there, and prevention programs to be discussed and brought out from there. So a national oncology center like Princess Margaret Hospital in Toronto, and the MD Anderson Institute in Texas, and the Sloan Kettering Institute, and the Johns Hopkins University and so on, where these are cancer centers. It was about 20% completed when we demitted office. The PNM government scrapped it altogether. And that was supposed to be a mecca for the management of cancer patients, which would have brought in health tourism into the country, because citizens from within the Caribbean would have been coming to Trinidad. I just remember a little experience myself. When I trained in Canada in 1988, at the 4 or 5 hospitals for about a year. When I left Canada and came back to Trinidad in 1988, most citizens from the Caribbean, from the small islands, when they went to Canada, they will tell them, look, Dr. Gopi Singh is in Trinidad, and he liaises with us. You can have your treatment and management right there. And that's how I was able to start having patients from within the Caribbean, St. Lucia, Grenada, Barbados, and a few of these, because I was in consultation with the guys in Toronto, with my colleagues there. So health tourism could have been a very successful one if we had continued this oncology center. So radiation treatment would have been at one place, and then we could have satellite centers for the chemotherapy, but governed by the main center. And most of the cancer surgery would have been done there by different teams of cancer surgeons. I don't know if the population knows that at Mount Hope Medical Complex Hospital, I believe that there are 17 operating theaters that were constructed there. I might be wrong, but it's something to check. And at any one time, only possibly about 4 of these operating theaters are functioning. Why? Why can't the other operating theaters which remain closed not be working? And so therefore, patients' surgeries are being delayed. And even more now, Ms. Doré and Mr. Ali and listeners and viewers, with the upsurge in crime, where gunshot wounds come in and patients survive. But when one gunshot wound come in and the surgeons have to make incision from the skin straight into the abdomen and examine every piece of bowel and every organ, the liver, kidney, spleen, gallbladder, everywhere. It takes hours from the surgeons to be able to fully understand and appreciate and work with the patient so that the patient comes out of operating theater in a better state and so on. But the operating theater tables are filled with these cases so that elective surgical cases, patients who are supposed to go in for surgery from 8 in the morning and you have a turnover of patients during the day, they are unable to have the operations because the 4 operating theaters at General Hospital are 5, and the few at Mount Hope will probably have patients who were shot or who were stabbed. And so I remember my younger days at Port of Spain Hospital when I left there in 1981, when we were young doctors. We want to do surgery, we go with the consultants, but a patient is on the operating theater table and the anesthetic machine is being used as the machine to give the oxygenation and so on. And so the intubators, all these operating theaters were utilized, so no surgery could have been done, no elective surgery. So when they make the statement that the crime is a health crisis, that is part of it. And of course, the amount of money you have to spend, and then the emotional and mental state and the mental health state of the citizens of this country, it is creating a real havoc in the minds of citizens in this country. So then you remember, I want to draw to the attention of the citizens again, the Children Life Fund, which helped save nearly 200 lives of children who would have ordinarily died. When Mrs. 𝗏𝗏𝗧𝘀 decided, I think it was what her second cabinet note, or might have been the first, to bring the Children Life Fund. And that worked efficiently and effectively. And now what has happened to it? Parents are still having to fight with the authorities for their children to be put on the list, to have their specialized surgical cases done abroad. And things like the minister then, Minister Khan and his team, had an external patient program so that if you were waiting for surgery for more than 3 months, you were sent out with teams that were working with the Ministry of Health to do various procedures like cataract surgery, joint replacement surgery, CT and MRIs, maxillofacial surgery, vascular surgery, angiograms, angioplasties, hernia, prostate. So the extended patient program ensured that patients who were waiting for surgery for more than 3 months were able to obtain the surgical procedures. So I think there might be other questions that you may want to ask and so on. So yes. I think I'll stop there now. And thank you for allowing me the opportunity to speak a little bit on some of these issues.
Dr. Gopi Singh, I want to thank you for that very vital information that you shared, and of course your very critical analysis of the health sector. And I just want to make a few comments. I was chatting with someone this week who was telling me the UNC and the PNM have the same policies. And I really hope that that person, I know the person that's on this program, was listening intently so you could see the difference between the UNC policies and the PNM policies. And also people ask you, well, what do UNC did? They seem to be clueless as to what the UNC would have done for healthcare. What was the vision for healthcare? And I mean, I would think that this program now would have answered and cleared up all of those questions. So again, Dr. Gopi Singh, I want to thank you very much, as I said, for sharing this vital information and doing a very critical analysis of the health sector. And just to summarize and focus on something that I keep saying, the problems we have in the health sector is not because of money, but management.
That's right.
And every sector in the country, it's not money. We have enough money. It's management and expertise and just caring.
And dedication to your purpose.
Exactly.
Fundamental dedication and a commitment to do better. And every citizen must strive to do better and better every day. And so in your profession, in your work, if now I believe I'm a doctor for nearly 1974 to now is almost 50 years. And a gynecologist now for 44 years and a cancer specialist, 1988 to now 36 years. I'm a cancer specialist in gynecology. Now, it called for determination and a willingness to succeed and do better and better. You want to be in a zone where you feel proud of yourself, you feel, so this is the aim and aspiration for all young citizens of Trinidad and Tobago in every field of endeavor. Aim to be the best. Do what is required to be the best. It is a sacrifice, it's a life of sacrifice. My colleagues will tell you some nights we don't sleep attending to patients, both in hospital and privately as well. So medicine is a purposeful job, is a gift from God. But the nurses and the doctors and the paramedical professionals, God has blessed them. And patients ought to receive the type of care. But when the doctors are stymied as a result of difficulties here and there, I'm sure it is the thinking and the wish of every member of this government, and it is certainly the wish of our opposition party and led by Mrs. 𝗧&𝗧'𝘀, to have the best healthcare system that we can boast of in the world. And it is in our grasp and in our reach. We had it there, and it can happen again. But the purposeful dedication and the proper management practices and techniques and principles and policies and programs must be put into place and looked at and examined critically from time to time to see where you're going wrong. So in-depth analyses from time to time to see what could be improved. And I want to make a special plea to the regional health authority boards. Get off of your lazy boardroom selves and get on to the hospitals and into the health centers, and to the wards, and see what is going on. See what the nurses are trying to do, and the doctors and the paramedical professionals, and what things are missing, and do what is required. I can't blame the minister alone all the time. He has to get to the boards, and if he appointed the boards, he has to take the blame. And the government and the cabinet has to take the blame, because the chairman of all these regional health authority boards. I want to make a very two questionable comments here tonight. This is my individual thinking, being a 50 years a doctor and being all around the world. For cancer care, we need to establish something like the Princess Margaret Hospital in Toronto, which is the premier institution in Canada for treating cancer cases, to have a national lottery. Princess Margaret Hospital has a lottery system to provide and generate funding for the management of cancer patients. And I want to put it out even to the present government, and I think my political leader would have heard me say that already, and there's something for us to actively consider. You could imagine what benefit the country gets from the national lottery, where that money goes. But if we have a dedicated amount of funding from a lottery for cancer cases, that takes a burden off the normal expenditure in the healthcare system. And this other one will be met with questionable comments around nationally. But this is coming from me, who have been through the systems around the world. Do we need 5 regional health authorities in Trinidad and Tobago? Do we need 4 in Trinidad? Do we need 2 instead of 4? Do we need to continue the overflowing of administrative personnel from hospital to hospital, the same type of people, HR manager, CEO, whatever manager, the other manager, doubling on themselves in the regional health authorities, doing the same thing, purchasing of pharmaceutical, purchasing of supplies, employing doctors here and nurses here. Time enough we wake up to the real issues in Trinidad and Tobago. Outdated, anachronistic, yes.
So Doc, we want to switch a little focus now onto COVID, right? And we saw recently in December, PAHO coming out and warning the population, issuing a warning, and then the Ministry of Health, playing catch up as always, came out with a warning after, warning that there's a new variation, a new strain of COVID, and we have to watch out and so on. So I have two questions concerning that, Doc. Are you satisfied with the measures being put in place by this present government to handle this new strain of COVID that seems to be increasing? One, and two, will you support a commission of inquiry into the previous COVID virus that took 4,200 and something deaths of our national citizens, 4,200 and something dead people due to COVID taking their lives? And that is questionable because we heard stories, horror stories about gas running out, no oxygen, no medication, and so on. So will a UNC government support a commission of inquiry into this present government handling of the COVID situation in 2020, 2021? And the first question, are you satisfied with the present management of this new COVID coming out here?
The answer to the first question, surprise, is the honorable political leader and myself and my colleagues have been speaking about, if we get into government, we will have a commission of inquiry into the management of the COVID epidemic and pandemic that we had in Trinidad and Tobago. Because a lot of the management of these, the COVID cases, left a lot to be desired. And there might be some criminal criminal negligence on the part of many in terms of the management of the COVID cases. We have had 4,000, I think, or you might be right, 4,200 or 4,400 deaths from COVID. And the families of these patients never knew what was happening to the families when they went into intensive care unit. First of all, there was not a very good education program. They didn't have personal protective equipment. When we asked them whether they have it, they said yes, they have it. They never had it, they lied. They took a long time to get the vaccines. When other countries were getting the vaccine, hundreds of people died as a result of no vaccine. Then they had them assembling in the rain to get vaccines when there were no vaccines at the centers. They had them dying in the room at 𝗏𝗏 Medical Sciences Complex where there was no oxygen in the cylinders, and they're waiting 6 days to get the result of the COVID test before they could move them anywhere. When they ended up in the intensive care unit, they were dying in trolleys, falling off the trolleys in the emergency department at 𝗏𝗏. Families never knew what was happening to their relatives because they were banned from going into the hospitals. They never knew. Sometimes they would only hear about their loved ones have died. Three weeks later, when they go to the mortuary, they can't even find the body inside there. When we ask what is the death rate in the intensive care units of 𝗏𝗏 Hospital, when we knew that they were close to about a 95% death rate. In fact, the 𝗏𝗏 report showed that there was a 99% death rate. Almost everybody, 9 out of 10 citizens who went into intensive care died. Why? You have one nurse in the intensive care to 3 or 4 patients. You had one junior doctor attending to the patients in the intensive care. Some of them wouldn't even know what the process of intubation, what is the difference in the airway pressure to be able to manage, and these patients died. And then most important as well, when they were told that there were 2 drugs that were available globally, and we told them to try to purchase these drugs, they never purchased them, and these drugs totally would have been about 18,000 for both of these drugs. A private hospital started managing these patients and saved a lot of lives because of these drugs. So the nurses overworked, understaffed, doctors overworked, understaffed, and they removed 6 of the top doctors, bright doctors from the front line and moved them out of the hospital because they didn't agree with what the mass man, who is the CEO, was doing. And they told him, and he deliberately and spitefully removed them. And then there was a surge of deaths in the hospital. And then all the issues related to that, families who wanted to cremate their loved ones were prevented from cremating them because they didn't have an understanding and appreciation of the laws that were governing. So it was a total mess. And people must never forget the havoc and the criminal nature of the management of this COVID suffers. But thanks for reminding me about that. And so then when Mrs. Bissessa and myself and a few of us pressed the government to have some questions answered, the Prime Minister reluctantly appointed a 4-person team or 5 persons, and he gave them 1 week to complete their work. And when they said they can't do it in 1 week, he said, all right, we extended for 3 months. And out of the 4,300 patients, they were provided with notes of about just maximum 50 patients. So they couldn't make a determination of what was really happening. And so everything was hidden from them. And now in their 114-page report, the Simangal report, congratulations to all the members of that committee, where they were frank and brutal in their comments. Out of that report, there were 19 or 20 recommendations. To date, the government has not implemented one of those recommendations 2 years ago. This is 2025 February, 2023 February, the recommendations were made. In terms of digitalization of medical records, in terms of the prevention and the management of the chronic non-communicable diseases of diabetes and hypertension and so on, nothing. Is pure old talk by the minister and non-performance. So we need a commission of inquiry. If we get back into government, which I almost certainly know that we will ensure that there's a commission of inquiry to point out the difficulties that families underwent and of course find where they went wrong. And now, as far as this one is concerned, the variant that have been coming into the population, a lot of families and so on are getting flu-like symptoms and a lot of body aches, runny nose, a chronic cough, a very productive cough, and a fever, and so on. And a lot of citizens believe it's a normal common cold, but they are not going to do the COVID testing. They don't bother themselves to do it, but they suffer. They suffer for 7 to 10 days. And then eventually a lot of them feel better, but there had been an increase, as the minister said, of COVID cases in December and January. There was an increase in January over December. And recently I asked publicly to give us an idea of what is happening with the COVID deaths. Give us some statistics. Give us some statistics about the upper and lower respiratory tract infections related to the respiratory syncytial virus, which is one of the type of viruses that is causing a lot of these problems. But no, hiding all the time, telling untruths all the time, then commenting that I am furthest from the truth. But come out and tell the population what is really happening. But as you said, Safraz, we're not having answers to any of these questions.
Doc, and I want to put on record that I lost an aunt in December because she got the cold. We thought it was the cold. And had we known that was COVID she got, we would have rushed that lady faster in the hospital, but she was battling it, poor lady, battling it home, battling it in her home, thinking she could ride it out. And the lady come and died. And then the next week after, the Ministry of Health come in to say, be careful, COVID is on the rise. They was hiding from November, December, hundreds of people were getting sick, Doc. and they didn't warn the population. I'm very angry about that, Doc.
Well, I hear your pain, 𝗧&𝗧'𝘀, and I empathize with you. And this is exactly what this government does. They put everything under the table. They hide it from the population because of their gross incompetence and inability to govern anything. This whole country is ungovernable, and you should take this up. You should really take this up. Now, it's important that we make this plea to the entire population. Once you're getting serious symptoms and you feel it's a common cold, do the COVID testing. It's not very expensive. And if it is COVID, well, you take the appropriate action to go to the health institutions that are managing COVID at this moment.
All right, guys, I just want to do a time check here. It is 9:11 and we will be doing a hard stop at 9:30. Now, I know everybody is anxious to make their contribution for hands up already, and we will give everybody the opportunity to speak, right? There is one issue I would like Dr. 𝗧&𝗧'𝘀 to address before we get into the comments and questions from the audience, and that is with respect to the front page of the Guardian newspaper today. Dr. 𝗧&𝗧'𝘀, I am not sure if you saw that story, right? And it was a fast food warning. The headline stated, "Fast food warning, Minister of Health slams mega fast food chains." Now, just quoting from the article, Minister of Health 𝗪𝗛 yesterday called out certain fast food brands as he once again lamented what he described as a scourge of hypertension and diabetes facing this country. They also maintained that the mega chains and companies had to take some blame for the health condition of some sectors of society, noting the focus had to be on prevention rather than cure. Now, he also made a specific reference to Coca-Cola, and he said that he referred to Coca-Cola as the poison. And he said that we voluntarily consume that poison, and then we turn to the free public health system and say, "Save me." Then in speaking about diabetes, he said it all had to do with Caribbean culture. So I would like to know if you share the same view as Minister Dial saying, in that certain brands and culture should take some blame for the health condition of some sectors of the society.
The Dr. Rowley's government and Minister Dial must take the majority of the blame for this issue. And he should be uncomfortable in making a statement like this at this time, when he has been the Minister of Health for the last 8 years. What has he been doing about the education of the citizens of Trinidad and Tobago in terms of the fast food and the soft drink industry? It is around the world. Certain countries have legislated in terms of the input of the contents for the manufacture of these fast foods. But then where is the education program, which would start in the schools to educate the children on the diet that is required, and to give them a proper understanding of the development of diseases and what some of these foods can cause? Increased caloric intake, high carbohydrates, the soft drink industry. Sure, they add to the obesity problem, and they add to the uncontrolled diabetes, and they add to someone probably becoming diabetic, and obesity brings on diabetes and hypertension, and they go hand in hand. Now, if you educate the children from small, and I was speaking about it earlier, and you continue the education, the adult education. I think once I was in Parliament and I made mention about the caloric intake of different types of foods and so on. Now, you just tell the population, well, look, if you have 1 doubles in the morning, it's about 400 calories. 1 soft drink is X amount of calories. But it's also a social problem, Ms. Dory. The social problem is the poverty that has increased. And population find it cheaper to buy a fast food with probably a protein in it and some vegetable and carbohydrates. That is one issue, the poverty. And I go into Maraval every day. I've been living there for 40-something years. And I see the outlets now to these fast food places. They block the streets because the outlets are, the inlets are crowded now. A lot of people buying more fast food because of this social problem. The low salaries, the unemployment, the poverty, and people are grabbing for what they can get to eat. They no longer have a choice to say to go, and the groceries are so expensive now that there has been almost, I would say, more than 100% increase within a few years, 1 or 2 years. So the population cannot afford it. Then there's a question of parenting. There are homes where there is a single mother, one mother to look after a family, absent fathers. They have to prepare meals for the children, so they get to a fast food, and that's the most, instead of having the children starving, they might buy a pizza or buy some fast food. So education, as I mentioned, what about the TV stations and radio stations and so on? And educate the population about the amount of calories that they're taking and avoid obesity, avoid, nothing wrong with having a soft drink, but not in excess. Nothing is wrong with having a fast food, not in excess. And the companies are there to make a profit. So you have to continue to work with them and see how they can reduce the non-essential and the adverse type of things that they put in the ingredients in the fast food. For instance, the oil in which it is fried and so on. And whether you can offer more grilled type of foods to the population rather than the oily things. So it's an education that could take place on the newspapers, in the social media, in the radio, on the television, and in schools particularly. So you blaming the fast food people, they want to make a profit, but you have to do what is required from your aspect. Speak to them. And then there are people who will tell you they're out in the sun for the entire day. They want something cold to drink, and they want some energy. A soft drink will probably give about 250 calories of energy with one soft drink, so it bites them over. No, you can't deprive somebody from that type of thing. And businesses are out to make money, but I saw he had a meeting with them, but what has come out of the meeting for him to be coming to say that they are the cause of but you're doing nothing for education of these things, and then for testing of these patients and for management of them, of the disease processes of diabetes and hypertension. So obesity, diabetes, hypertension, cardiac disease, heart attacks, strokes, blindness, amputations, all related. So there is some degree of concern at international levels and national levels. Now, the Coke, you have some of the restaurants now using the MSGs, monosodium glutamate, which tastes very well, but they have a certain degree of cardiotoxicity, toxicity to the cardiac conductivity and the heartbeats and so on. Now the 0 calories, there were the soft drinks with no calories where there's aspartate, that has some negative consequences. And we can speak for a long time on it, but there is a certain amount of neurotoxicity that occurs with the aspartate in the 0 calorie drinks. The manufacturers probably would not openly tell the population that, but this is where governments, ministers of health, and the health nutritionists should be talking to the population on these things. Most of them probably are even more versed than we as doctors are versed in dealing with some of these issues. So it's unfortunate that he's blaming an entire industry. They ought to make the profit, but conduct meaningful discussions with them and see. I'm sure they're willing to work with the government for the protection of the people. They are not there to destroy the lives of the people, but they put two hands together and work together, and something good will come out of it. But don't just go blaming and you don't know what you're blaming them when it is in your hands in the first instance to deal with it. You know that 8 years ago, you know, talking about it, he says now he's on his way out. I hope he knows he's on his way out. 8 years later, nearly 9 years later, that he's talking about it. This Minister of Health has been in that job for too long. And Prime Minister Rowley should have removed him a long time ago, because he has become fossilized in that position, in a position that he really doesn't know very much about. He learned on the job, but he's still learning, and it's very sad that the people of this country are continuing to suffer as a result of his incompetence.
All right, so maybe we can get into the open mic Q&A session, all right? Now, guys, we do want to end at 9:30, so I am going to ask you to keep it brief. Alim, you want to unmute and go ahead?
First of all, let me congratulate Dr. Gopi Singh. He said plenty of things I wanted to say, but I just want to let him know, you have to think about between 1973 and 81, the construction of the...
When your dad was there, yes. Yeah. I had the privilege of being a doctor in the time of your dad being Minister of Health.
Right, and you know he did a lot of... He was the one responsible for that medical sciences complex. I'll go into the RHAs because I happen to be a member of the North Central Regional Health Authority, thanks to Minister Khan and the Prime Minister who put me on that board. You raised a question just now whether 1 RHA, 2 RHA, 4 RHA, or 5, or 1. I remember just before we left office, there was discussions that we should have 1 RHA in Trinidad and Tobago, where we take the expertise within the health sector and have 1, because it is really an expensive thing to carry all these RHAs, or maybe 2, 1 in the north, 1 in the south. Because I know you yourself was chairman of Northwest Regional Health Authority. And with respect to the
97 to 2000.
Yes. I remember pulling you out of a meeting to go and get one of our relatives' body when they died. I remember that. What also happened too is that you remember the medical health tourism. I remember going to India with Minister Griffith at that time, and we negotiated with 2 of the largest health institutions with respect to medical tourism, Fortis and Apollo. And we brought them to Trinidad, and they were looking at all the health institutions, both private and public. And the 𝗬𝗏 facility was designed to be one of the centers for medical tourism. I'm certain about that. And one of the areas, I heard how you lamented on the question of the oncology center, but you missed out another one. Just before we left office on the 15th of August, we turned the search for a renal complex right next to Mount Up Maternity Hospital to house 60 beds, so that people could have gone for their dialysis, and they could have done at least 100 people a day, and that shut down too. And that is something which is needed in Trinidad, because you have limited spaces, as you know, as a doctor, in the country. You spoke of the pharmaceuticals. I happen to be a owner of a pharmacy. One of the big problems with the CDAP drugs and the supply of CDAP drugs is not that they can't get it. We know I had a drugstore. You have generic drugs, you have original drugs. And what you rightly said, some of the things are like high blood pressure and diabetes, they use a lot of generic drugs and they do not work. And this is one of the problems you have. And in addition to that, while some people cannot get their CDAP drugs that they go to in the pharmacies, is that many companies in the country have been owed by the government for the supply of their pharmaceuticals. So that even if you go with your CDAP prescription to get your CDAP and you see a customer buying the same thing over the counter, is because some of the suppliers prefer to give it to the pharmacies because they get paid. and they do it. But I know for a fact that some people use their pension money when they can't get the CDAP drugs. And really and truly, I remember too in August of 2015, Dr. Khan launched the health card, and it was across the board. I think you remember that we had a big launch, and the health card started being distributed throughout Trinidad, and it was stopped by this government. So if we were in power, almost the entire nation, rich, poor, young, old, was getting the health card, because I was part of that. I was part of the medical tourism aspect. So that is why the things like this, what you talk tonight, and that oncology center hurts me, because every time I pass Mount Hope, I remember sitting every board meeting with a particular gentleman who sat on our board, and he was the coordinator for that oncology center, right? Today, and the oncology center was also designed to develop medical tourism with people coming from the Caribbean and even from America to get their things done. We were going to put a hotel on the East-West corridor to develop health tourism. So what you said here tonight, and with respect to drugs, pharmaceuticals, and you're quite correct. Now it is very hard for doctors to get jobs. In our days, we never give a 1-month contract. We give between 2 and 3-year contracts. And at the Mount Hope maternity, I remember you would have remembered when that child died, an era when they were doing the delivery, and an inquiry was launched, and we immediately as a board decided to implement the recommendations of that committee. You're quite correct. So that I must say, I must compliment you, Doctor. I know you were a great friend of my father. I think you have made a significant contribution to the health sector. I remember you working with Dr. 𝗧&𝗧'𝘀, Dr. Bishra Mahabir, the commoners. Am I correct? Right?
That's
know
right.
the contribution. Right? I remember those old days in the Ministry of Health, because I myself worked in the Ministry of Health. In fact, in 1974, I was privileged to go to the World Health Conference with my dad as a member of the team. And this is where the idea came about Eric Williams Medical Sciences Complex. And that was when he went and when he delivered his speech, he got a standing ovation. And that after that, he was nominated 4 years after as the president of the World Health Organization for the contribution our country was making for the development of health. So I just want to share some of these things, and I want to support your whatever you said tonight about the health sector, because I had the practical experience working to thanks the former Prime Minister and the next Prime Minister of Trinidad and Tobago, who vexed about that. That's the facts. And and Dr. Khan, I can tell you, Dr. Khan, Dr. Hamza Rafi, and I'm sorry, there's I want to compliment, and let's move on and see how things work before the next election or after the next election.
Thank you. But because we are short on time now, so we want to give everybody the opportunity to talk. I think Brian, you're next. And again, it's 9:29, so we kind of already out of time. Brian, can you unmute and make the contribution?
Good night. I will be as brief as possible. A pleasant good night to my NATREX colleague, Dr. 𝗏&𝗧'𝗀.
Good evening, Brian.
I have known Dr. 𝗏&𝗧'𝗀 for years. And I want to say that Dr. 𝗏&𝗧'𝗀 continues to show why persons like Dr. 𝗏&𝗧'𝗀 is in the United National Congress. Dr. 𝗏&𝗧'𝗀 could have been like other persons and say, well, after 2020, I'm out of the politics, I'm out of everything. Dr. 𝗏&𝗧'𝗀 has been a man who has been there with the party. He's a major contributor with the NATREX as our COO. Dr. 𝗏&𝗧'𝗀 is also there to guide persons like myself in this party. Dr. 𝗏&𝗧'_Eng is one of the main reasons why people like me are in the United National Congress. I first met Dr. 𝗏&𝗧'_Eng in 2007 when when Mr. Pandey had made Dr. 𝗏&𝗧'_Eng the coordinator for St. Joseph's seat. In 2007, then he went to become the Member of Parliament for Caroni East. Dr. 𝗏&𝗧'_Eng has always been a mold of the young persons in this party. He continues to be there, a guiding light for many of us, such as myself. In 2011, when I was called to the bar,
Dr. 𝗂𝗶 congratulated me. But I want Dr. 𝗂𝗶 to remember, I want Dr. 𝗂𝗶 to always remember this. In 2008, Mr. Pandey had made me a member of the Senate, as when I was a part of the United National Youth Arm. After the then leader, Mr. Pandey, and our current leader, 𝗏𝗏 congratulated me. Dr. 𝗂𝗶 called me and told me he was very pleased to know Mr. Pandey had put me in the Senate. I acted in the Senate many times in 2019. Dr. 𝗂𝗶 has always been there to keep us in this party going strong. Dr. 𝗂𝗶, it's a pleasure to continue to work with you, sir. You are a guiding light. You continue to show people why people like yourself continue to show the UNC under 𝗏𝗏 will go back into government. Doc, I enjoyed listening to you tonight. I heard history. I was edified. And as a member of INATEX with yourself, we will form the next government, Doc. Thank you again, always, Dr. 𝗂𝗶, for your contributions.
Thank you very much, Attorney at Law, Mr. Brian Bigg. It's a privilege to have you all close by and to, in my own way, help to guide you all along in the, 30 years experience in politics. So it's really a nice thing to have the younger ones in the party and to help to move the party in the direction for governance once more.
Okay, Gary, can you unmute and make the contribution, please?
Good night, Dr. 𝗂𝗶.
Hi, Gary. I
Listening
missed you.
audience, thank you for taking the time to join us. This topic has to be quite a few sessions. We have to keep an ongoing session, whether it's in this platform or any platform possible, because I think the population needs to hear these things and the issues a little more frequently, that they can sink into them. And maybe they will make up their minds to take a stand at some point. I'm sure a lot of them have experienced personal issues with the health sector. I mean, I had to deal with an issue last December here, where a lady went into Mount Hope. She was 4 days in there with chest pain and some kind of a flu, and they were totally ignoring her. I had to reach out to the ministry and several doctors within the Mount Hope facility that I was acquainted with. By the next day, she had several doctors around her on medication, but for the first 4 days, she was sitting there. So I am just kind of concerned, unless you really know somebody, you're getting some kind of attention. You know, it was really, I had to really go crazy reaching out to people. This government, as far as I'm concerned, has no regards or respect for anybody. As far as I can see, after almost 9 years, I don't think first of all, they show no interest in taking any advice. I've seen you stand up in the parliament and made advice during the COVID session when we was about to face that. They took none. They took no advice from me, letting them know what was going on with our people overseas. I had to force their hand and fight very badly with them to assist our people. So that is, there's a lot to be discussed. But I am just so concerned what's taking place. We know we have information of doctors being overworked and mistreated in the health sector. They can't get the time to eat sometimes. There's so many things going on, and I'm uncomfortable with seeing the population very relaxed with what's going on, because they themselves are facing it. I am outside the country. I'm hearing these things, but you are dealing with in the country, and I don't see them rising up in a real serious manner, because this is affecting them directly every day. I try to, I'm going to try to wrap up because we need to really have more sessions in this. I did try to provide some assistance with volunteer EMT training for people that was rejected by the government. You mentioned so many people getting shot in the country. I mean, if citizens are trained to assist them before emergency care gets there, this will be something very helpful. So this is something we need to work on, and you and I will discuss more on this, as far as getting people trained within the local community to respond to emergencies. We know our ambulances are lacking proper equipment, and our people are lacking training, and there's so many things to correct in this country. So we definitely have to remove this government, and I really appreciate having you on board here, and we will continue the discussion. Thank you very much.
Okay, Mr. Mabra. All the best, Gary.
All right, and if we could just take Trini very quickly. I know we're already out of time. Trini, we are out of time, so make it quick, please.
Good night, ladies and gentlemen. Good night, Dr. Gopi Singh. Thank you once again. You have always impressed us with your presentations, both in Parliament and on platforms. Aleem stole most of what I wanted to say, and you yourself covered most of it with your very clinical analysis of our health situation in Trinidad and Tobago. Maybe you could elaborate briefly on that idea of digitization of records that Aleem spoke about, and you mentioned briefly. That was a nice program that would have digitized records and made it easier for citizens, especially the old pensioners and the I don't want to say the people in rural areas to access medical care. Maybe you could elaborate on what that was about. I know what it is about, but I want you to elaborate so that the population will understand what will be ahead if they do the right thing and get the UNC back on track to take this government and take this country forward for holistic development and healthcare and improving our life and economy and all the rest of it.
Yeah, thank you very much for bringing this point up. Well, the government now try to boast about the whole Ministry of Digitization and so on, but they're going nowhere with it. And it spans the necessity for digitization of a number of areas, like the public service, where you have about 40,000 employees there. Their records are still in paper chasing. I was, well, in the Ministry of Education, where you have 16 or 17,000 teachers, where their records are still moving from area to area by the books, the booklets, where if there was the digitization, the issues of transfers and moving from one level to another, and a number of things could be done with the Teaching Service Commission in a very fast manner. As far as the health sector, when you have to have large storerooms to store the case dockets and the notes of patients, and you have to have teams of employees in the medical records department, and sometimes one note goes astray. It becomes difficult to manage a patient when you can't get the medical records. Now, if the medical record of a citizen is digitized, that person has that information confidential. Nobody has that information. And therefore, when they go to see a medical personnel, that information is there for the doctor to see or the nurse to see. And therefore, it makes it very simple. But also there would be the necessity for training of the medical professionals, the nurses, the doctors, and so on, in terms of how they record patients' history and notes and treatment and so on. So it calls for an all-round training program, first of all, for the digitization of the records, which will take some time. And I think Aleem mentioned the health cards were given to about a number of thousands of citizens so that they could have gotten their pharmaceuticals from the pharmacies based on their cards when they presented it. So your point that you're bringing there is a very valid one, and it needs urgent attention for digitization. And I mean, there is a 1.4 million population, and it will take some time, but it could be done and should be done as quickly as possible. If you have to have international help.
Let me come in here. Let me just come in here. I sat on the Medical Records Committee of the board, and we started the medical records in 2012. That is why the health card came out, because we started at Mount Hope and all the other regions. You would know about that. You was in the interministerial team. And we started medical records. So when the government hit in the chest, it started under our government. So when they said they have, it's our record. We started, we had people here, and I was involved at a weekly meeting for almost 3 years. With our medical records team, we had a foreign team here doing it with our local people, and we were getting a weekly.
Right.
So we
So
did
what you're
have.
saying, what
Yes.
you're saying there, it confirms the fact and the necessity for continuing active work, as what the caller has just indicated, for the digitization of medical records, personal records of every citizen who has been in a public institution, and even those in private institutions. I think their records are now being dealt with at a computerized level. So the point is very valid. That is one of the futuristic thing to be done as early as possible. One of the other important point I wanted to make, that in countries abroad, since we have about 10 hospitals in Trinidad and Tobago, there are a number of various disciplines which overlap. So you have orthopedic care in one hospital, and another hospital, and another hospital. The time has come for the centralization of services. Just like, so you have orthopedics in one major hospital, you have neurosurgery in another hospital, or whether it's the same hospital. So you have the focus with a team of specialists and consultants who are working particularly and focused in that hospital. So somebody gets into an accident, there's a neurosurgical problem, they know that this is a hospital deals with all neurosurgical cases. This is a hospital deals with ENT cases. This hospital which deals with pediatrics. I mean, when Mount Hope was being built, the 𝗧&𝗧'𝘀 Medical Sciences Complex, after it was completed, there were a certain amount, 100 beds for pediatric cases. I was chairman, as Ali mentioned, of the Northwest Regional Health Authority at the time between 1997 to 2000. And also I became chairman of the Central Regional Health Authority in 1999 to 2000. And we had to close 4 of the pediatric wards at Port of Spain to ensure that all the children from the north part of Trinidad and Tobago could have sought medical attention at the 𝗦𝗲&𝗃 Pediatric Hospital. So we closed the Port of Spain Hospital pediatric wards just to ensure centralization of all pediatric care at the 𝗧&𝗃 Medical Sciences Complex. And that wing was called the 𝗦𝗲&𝗃 Pediatric Institution. So there is need for thinking and greater in-depth thinking and movement and implementation of a number of these policies that we should really seek at a national level consultations and get the buy-in with the national population. We just can't go and do it by ourselves. And this is where we need as a responsible opposition, which we are doing now, and under the leadership of Mrs. Kamla Persad-Bissessor, seeking information and support and questions being answered and questions being asked in terms of the determination of policies and programs on the way forward in most of the areas of governance.
Okay, I see, Gary, you have your hand up, and now it's 9:43, so maybe a final comment, and then we wrap up.
Yeah, just one quick thing. I know we would have to do some more sessions, but Doc, I have sought help for us in Trinidad from hospitals over here in the US and EMT training, all these different things. So when we take government, we could get some of these hospitals to participate as a partner with us. This is something. I think this is the best thing to do. Instead of sending, it'll be less costly for us to bring people to train our people in Trinidad than to send them overseas for training.
Certainly, I echo your sentiments. And you see, let's think about even cancer care and treatment. We have Johns Hopkins University, which can link with us. We have the MD in Anderson, Texas, in Texas, the University of Miami, the Sylvester Cancer Institute, and so on. So your point is very valid. I would link with them. We create the health tourism, we create the training, and so on. And that is the way that we have to continue to look at and to move forward with, in terms of some of these programs that would be meaningful to Trinidad and Tobago and the citizens.
Okay, so guys, it is now 9:45. We are over time. Dr. Gopi Singh, I know you've said a lot, but do you have any final closing remarks for us?
Well, thank you for affording me the opportunity to speak a bit on the health sector to your program and the questions that have come forward from your colleagues and the audience. And it has been a great privilege and a pleasure for me to share some of my experiences and my insight into some of the healthcare issues. I want to wish the citizens of Trinidad and Tobago the best of health. Look after yourselves, look after your families, do the preventive aspects by ensuring your diet, exercise to prevent diabetes, go for your screening programs, educate yourselves a little more on the necessity for taking care of your health, and because your health is your wealth. And that's important, and the government has to continue, to step up the ability to look after the citizens, which they have not been doing over the last 8.5 to 9 years. It's a very sad state of affairs in terms of governance at almost all levels, in almost every discipline in Trinidad and Tobago. And health is one of the most critical, important areas. They have been failing, they continue to fail, and there seem to be no ability to swing things around so that patients would receive the type of healthcare that they really need and supposed to be under their democratic constitutional rights to be receiving. Thank you. It's an honor and privilege.
Okay, Safraz, any final closing remarks for us?
Sure. Doc, I just want to say that this was truly an honor. I mean, Brian said it all, but I would like to say it also that, I mean, this is the first time I'm actually on a platform with you, Doc, and I have so much respect for you, Doc. I can't start and stop counting the honor it is for me to be here with you and to hear you elucidate all these issues one after the other, systematic, methodical, yet still you are direct on the point, and the point being that there's a lack of leadership from the PNM government for the last 8 years concerning health. And like any other sector in the government, everything is failing. But more particularly for us tonight, the health, Doc. And Doc, I was a manager at one of the RHAs, and I could tell you, I have information, employees are calling me, and these RHAs are runaway horses, Doc. And they are like laws unto themselves, doing very unethical things under the present CEOs. I will share some of this information with you, Doc, and you could probably take it to a next level. But I am telling you that under this government, things are happening and systems are dismantling for the benefit of themselves. The CEOs, the senior managers in the RHAs, even the Ministry of Health officials. And it's a selfish mentality under this government. Take care of yourself, take care of finances, let the people suffer. And we, the people, need to stand up and change that direction. Otherwise, we wouldn't have a Trinidad and Tobago in a couple of years' time. Thanks very much, Doc, for your expertise.
You have summarized it very nicely, Safraz, and thank you a lot for what you continue to do for the party and for the people.
Well, in closing, Dr. 𝗚𝗶𝗃𝗃,
yeah, thank you as well for having me on the program.
Dr. 𝗚𝗶𝗃, I hope you realize how loved and well respected you are within the UNC community, yeah?
Oh, thank you, Lee. It's a privilege to be part of the team. And we're all in this together. I mean, God has been good. I've been there 30 years now, 93 to now. How much is that? 93, 94. I help Mr. Pandey. I continue to help Mrs. Bisessa. And God is good. I have good health still. I still do my little exercises at my age, my seniority. But it's a real privilege and to be working alongside my younger colleagues in the political atmosphere and to be assisting the political leader in whatever manner she wants me and asks me to assist in. Is really, she's a tremendous leader. A great deal of respect and admiration for her capabilities and her dedication to her duty as Prime Minister and leader of the opposition.
Absolutely. So I just want to end by thanking you again, Dr. 𝗚𝗶𝗃, for sharing some vital information with us and doing, as I said before, a very critical analysis of the health sector. Thank you for reminding us that health is your wealth. I want to thank everybody who join us on the program on Zoom and on social media. Thank you for your questions, your comments. My apologies for not being able to address all the questions I'm seeing on the chat. We just did not have time. But that is a reason, as Gary would have said, to continue our discussions. So I just wanted to just wish everybody, you know, a good night, stay safe, and we'll see you all again next week, Tuesday at 8 p.m.
Good night, everyone. Good night.